So one of the most common conditions that patients will come to see me with is acne. We will all suffer from acne at some point in our lives, and often it's very mild and doesn't cause us any significant concerns, but it can be severe and it can have major consequences for people, and not only psychological consequences, but also scarring, which is lifelong. So when somebody comes to see me about acne, my first thing I want to do is to understand their journey, their concerns, how it's affected them, and often patients may feel that people haven't taken it seriously or they haven't been offered effective treatments. I'll then want to have a look at the skin and assess the types of acne lesions which are there, because that will help us to tailor the treatments, the severity of the acne, but also importantly to confirm that is the correct diagnosis. Whilst acne is fairly easy to diagnose, there's some other conditions which can look similar. Things like milia, which can look similar to comedones, another condition called perioral dermatitis, and rosacea as well, which can also look a bit similar to acne. So it's really important to make sure that we're treating the right thing, because the treatment's obviously very different. Once we've established the diagnosis and understand the patient's concerns, the next step after this really is to go through the different options. And as with many conditions, there's a ladder of treatments. And usually the first rung of the ladder is topical treatments, creams, ointments and gels, particularly things like topical retinoids, topical antibiotics, antiseptics. Moving up to the next rung of the ladder, then really we're talking about tablet treatments. Usually a course of antibiotic tablets is a good first line approach. It can sometimes get things under control, and then you can maintain good control with the topical treatments going forward. But that doesn't work for everybody, and some patients have acne which is quite severe even when they first come to the clinic, and it's clear that these relatively simple approaches are not going to be sufficient. And then we're talking about more powerful, more specialised tablet treatments. And this is where the treatment options diverge slightly for men and for women. The key difference is that whilst both men and women do have testosterone, the male hormone, it's at much lower level in women, and we can use that to our advantage, because certain types of acne, particularly acne around the chin and jawline, which we see cyclically in women, is hormonally driven by this male hormone, and we can use medicines which actually block the effects of this male hormone on the skin. So this includes the oral contraceptive pill, particularly the pill where it's got an anti-androgen, a medicine which blocks the male hormone, such as Yasmin. Another good medicine which can target hormonal acne in women is spironolactone. And this works again by blocking that male hormone, but without affecting the female sex hormones. Generally very well tolerated, good treatment for hormonal acne. You can take it as long as you need to, and for most women, very minimal side effects. Now moving on, then this is where the pathways rejoin, and this is coming on to the overall most effective treatment for acne for both men and women, which is isotretinoin, also known as Roaccutane or Accutane. It is a very effective treatment. It will give a long-lasting improvement in acne in at least 85 to 90% of patients, but it is a powerful medicine. It does have potential for side effects, and that's really important that we're weighing up the risks and benefits of the treatment. Everybody will get dry lips and dry skin. It does have some other very important risks, so it's essential that women do not become pregnant whilst they're taking it, because it causes severe fetal malformations. It can affect the mood, it's been linked with depression, and very rarely it's been linked with even suicide. So really important that patients with mental health problems, that they had appropriate assessment and that they got the right support in place if they're considering this as a treatment option. A long list of other rarer side effects, things like irritating the liver, disturbing the fats in the blood, or affecting sexual function. And if you're coming to me to talk about this, I'll go through these options with you, and we'll talk about the pros and cons of the treatment. Now, that being said, it's important to stress that I've treated probably hundreds, if not thousands, of patients with this medicine, and vast majority have seen really good results with minimal side effects.